Right, let's take a look at ahead for World AIDS Day coming up next week. This year's UNAIDS report warns that the global fight against HIV is facing its most serious crisis in decades. A sudden collapse in international support, combined with rising geopolitical tensions, has severely disrupted prevention, treatment, and community-led services worldwide. The new report, released ahead of World AIDS Day on the 1st of December, paints a stark picture of how fragile decades of progress have become disrupted in many ways. Yet it also offers a message of resilience and transformation, a call for renewed solidarity, innovation, and local ownership of the AIDS response. Well, joining us now to unpack what this all means for us is East and Southern Africa Director, UNAIDS Regional Support Team, Anne Githuku Shongwe. Thank you so much indeed for joining us, and welcome to the program.
Thank you so much, Peter. Really good to see you again.
Yes, it's been a while, far too long, especially on a subject like this. We should be talking more frequently. So let's talk about this UNAIDS report. What would you say are the most urgent warning signs or findings that we should be paying attention to this year?
I think the most important point is that the great progress that we made in this region is really been disrupted, and we are in a fragile state. While we were really racing fast towards 2030 as the time and the marker that we have set for ourselves as when AIDS would end as a public health threat, is now likely to be disrupted. We are anticipating that there could be additional new infections than we had anticipated, and others losing the gains that they had already made, where countries in our region, in particular Zimbabwe, Malawi, Botswana, Eswatini, Namibia, had done exceptionally well. The threat of the lack of services to those who are most vulnerable, particularly girls and young women, key populations, these are sex workers and men who are having sex with men and those who are injecting drugs. These are the most vulnerable populations, and their services were disrupted completely because many of their services, unfortunately, prevention services, were provided through external funding. And so this is really one of the big messages, is that, we are anticipating growth in new infections. And we are also concerned that what we had anticipated in terms of the funding landscape, it dropped by about 30 to 40% in 2025 from external resources. We had already started, Peter, work with governments to plan a gradual reduction of external funding and an increase of domestic resources. But the cut was so sudden and so disruptive that countries didn't have the opportunity to sort of catch their breath and be able to realign the programs that had been planned over time. And so really for the first part of this year, it was a real desperation as countries were trying to figure out, how do we keep people on treatment? How do we make sure that we don't lose ground? And so that has been quite devastating, particularly for communities and people living with HIV who lost a lot of these services directly. So that has been quite devastating.
You said it's been a huge disruption, but I suspect that it's been quite severe in terms of possible even loss of life. Do you think? What have been the consequences that you've seen immediately?
Well, what we're seeing is of course, there's a lot of anecdotal stories going around about hospitals full of people who are in advanced AIDS disease. But we work on data and evidence, and we don't have that data yet to be able to show us clearly what has happened in terms of deaths in particular. But we can give some data, for example, that condom use dropped in countries by up to 55%. where in Uganda, young people in particular were receiving PrEP, which is, preventative medication. That declined by close to 40% and over 60% in Burundi. So we've seen those are direct disruptions because you can measure them immediately. And then we also saw many organizations, community organizations of young women lost 60% of their funding. But the ability to actually say that X number of people have died, we don't want it to be inflammatory. And so we have not gone and said, this is what's happening. But we are hearing more and more of people who were already virally suppressed, and because there were delays, may have then had, picked up, opportunistic infections or are in hospitals more than they were before. But we are loath to say at this point that there's a lot of evidence that there has been significant deaths as a result of this. What we have
All right,
seen,
so
for example,
as we approach World AIDS Day, what's the key message that you want the world and particularly African governments to hear?
well, first of all, AIDS is still with us, and we cannot turn our faces away from it. We have to stay focused on it. That prevention is an important area of investment. We see that when governments came back, and we're really, really proud of many African governments who showed their resilience by insisting on maintaining their populations on treatment. And so where there was loss of funding from global partners, governments stepped in and said, here, come into our clinics and serve, and we will provide treatment. So there is a lot of resilience that we've seen from African governments. But what is of concern is that those who are most vulnerable are continuing to be excluded from services because of stigma and discrimination. In countries where there's criminalization of same-sex relations and so on, it's much harder for them to be able to access services. For young women and girls, as you know, Peter, 3,000 girls are infected every single week in our region. And this persists because a lot of the underlying inequalities that drive the vulnerability have not changed. Those have not shifted. And the resources for them, 2.5 million girls who were on a program called Dreams that was supporting them with US funding, lost that funding overnight. And this is work that was related to education, to cash transfers, to being able to actually engage in economic activities that prevented transactional risky sex. This has persisted. And so the big message is that prevention is critical. Let's continue to invest in prevention. Let's make sure that governments continue to invest in their own responses, that we are able to build a sustainable response. AIDS is with us for many years to come. It's not over yet. And so we have to continue to do what we need to do to prevent the continued extension of HIV.
And let's make sure that we have this conversation more than just once a year, because it is that important, especially given the scenario that's playing out. But thanks so much indeed for joining us today and always giving us a good heads up on our fight against AIDS, HIV and AIDS. Thank you so much.
Thanks, Peter. Good to see you. Thanks for the opportunity.
Thank you. That's Anne Githuku Shongwe, who's the Regional Director for UNAIDS Eastern and Southern Africa, joining us talking about the new UNAIDS report.